Okay. Can I have everyone's attention, please? Okay. Is everyone who is here in the room set to go? Are you all ready? Okay. Okay. And we'll make sure all that's set up. Okay. So good afternoon. My name is Amber Smock. I am the Vice President of Advocacy for Access Living, which is a disability rights and services organization. For the record, my name is spelled AMBERSMOCK, Amber Smock. My organization is based in Chicago, but the advocacy that we do goes throughout the state, and it's in our statewide advocacy capacity here that we're here today. What we are here to do today is we have a panel of people who have various positions, various perspectives on assisted suicide, or what is also called medical aid in dying. A third name for it is also called physician-assisted suicide. So what this issue is that there is a bill right now in the Senate, Senate Bill 3499, that aims to introduce physician-assisted suicide to Illinois. To be very clear, what it would do is allow people to ask their doctors for a prescription for lethal medication to end their lives. The bill in Illinois is designed to make it available to people with 6 months or less to live. And so people who support the bill are very much of the position that this is about the choice to end your life at the time of your choosing. However, you will hear from the speakers here today about why this particular bill, but in as a larger concept, why assisted suicide is not a good choice for Illinois. And so I'm going to be speaking a little bit about why Access Living opposes Senate Bill 3499, and then we're going to hear some personal stories from people who were steered or coerced towards assisted suicide options, as well as a perspective from medical professionals. So that's what we're going to do today. Okay. So I want to talk a little bit about Access Living and why we oppose Senate Bill 3499. Access Living has been a disability-led, disability rights organization based in Chicago since 1980. At least since then, we have been tracking the end-of-life debate. And back in the 80s, we heard a lot about the Hemlock Society. We heard about Dr. Kevorkian taking people into the woods with his van of death, right? And we also know that in the disability world, people with disabilities are at higher risk of neglect, abuse, other kinds of harm, sexual assault. We know that people with disabilities and older folks are more vulnerable to steering, coercion, et cetera, et cetera. We also deal with the fact that we don't have enough home and community-based services. And what happens is we see instances of what's called mercy killing, where family caregivers or other people that are providing care for a senior person with a disability will kill that person and often end their own lives because they feel like it's just too much to bear. But that's because there aren't services. It's not because disabled lives aren't worth living. And so we want to talk about the fact that disabled lives are worth living. And we want to talk about the fact that disability civil rights is there for a reason. Okay. You okay there? Okay. Okay. So here I'm going to list out some of the reasons why Access Living opposes the bill. So first of all, proponents will say that the assisted suicide bill provides a lot of safeguards. They'll say there's more than 20 safeguards in this bill. They will protect people with disabilities. Nobody who is not supposed to participate will get hurt. But what we know from studies done by the National Council on Disability is that those safeguards are not effective for people with disabilities. And the last time they reaffirmed that was in 2019 with their last major federal report talking about opposition to assisted suicide. We also know that we are asked a lot for data about how does assisted suicide affect people and so forth. But the problem is that existing assisted suicide laws make it extremely difficult to actually collect the data necessary to understand what's happening in those situations. And those laws also fail to set up an investigation mechanism. There is no way to investigate these cases to find out what actually happens in these instances. That's a problem. Third, we also know that because of recent studies, once again, that physicians, with all due respect to our colleague up front, The majority of physicians do have inherent bias towards people with disabilities. And so there was a study that said that 82.4% of doctors feel that their patients with significant disabilities don't have good quality of life. I'd like you to take a look in the hallway and ask the folks who are all here as to whether they think they have good quality of life, but I have a feeling that their opinions are going to be very different from what their doctor has to say. We know that bias is complicated. It can also be complicated by race, class, and so forth. So trying to get a good handle on whether your doctor really knows the best for you, that's actually not possible for a lot of people. It is also flatly untrue that physician-assisted suicide does not create situations of coercion. You will hear that a lot. There's no data that supports that there's coercion steering towards assisted suicide. Whoopsie. So that's not true. But again, because the laws do not allow for the collection of data and the investigation, that data does not exist. So it is disingenuous to say it doesn't exist, when in fact you're going to hear today from people who that happened to. Okay. I also want to say that, we in Illinois know that there's statewide inconsistency in locally available, affordable, quality health care across the state. Illinoisans with disabilities and people with terminal disease already have a difficult time securing the health care that they need. How much time do we all spend on the phone with health insurance? But this bill doesn't address health insurance. It doesn't address coverage. It ignores all of that and says, oh, well, of course it would be good to have an option to end your life with lethal medication. Last couple of points. Pain is often brought up as a reason why people would want to be able to have the option of assisted suicide. But pain is not the primary reason that people request a prescription for lethal medication. The most recent available report from Oregon's Death with Dignity Act in 2022 reported that, as in previous years, the three most frequently reported end-of-life concerns were decreasing ability to participate in activities that made life enjoyable. 89% of people said that was a reason. They said that loss of autonomy, being able to control your own life, that was important. That's 86%. And then 62% of people also said that they felt like there was a loss of dignity. What that interprets to is feeling like it's really embarrassing to have someone come do your toileting needs, wipe your butt. Okay? But all of those are things that people with disabilities live with every day, and how we deal with it is by meeting access needs, by making things accessible. Few more points. We also know that predicting the end of life is an inaccurate science. And, the accuracy can actually range between 23% correct to 78% correct. So a 6-month framing is not a definite, clear, distinct qualification. I also want to point out that people have asked, well, let's just try to pass this law and then, that will be it. When you pass a law, that is never the end. You can always amend a law. Just because you pass this law doesn't mean it can't be changed later to expand, to include other populations, or to increase access. That's a problem. And then last of all, we also know that simply passing Senate Bill 3499, even though it's a relatively conservative bill compared to other states, it is not going to be the end of the debate for some folks who advocate for aid and dying. So, for example, there's a group called the Final Exit Network. They want assisted suicide not just to be available to people with 6 months or less to live, but also to people with chronic illness. They want it to be available to people with psychiatric disabilities. They want to make it pretty widely accessible so that you can basically just about end your life and ask for lethal medication whenever you want. So it's very important to pay attention to all the players on this. And what I'm going to do is I'm going to go ahead and turn it next to Dr. Garner, who is going to talk about the medical perspective, and then we'll hear some personal stories. So Dr. Garner, if you'd like to go.
Good afternoon. My name is Kevin Garner. I'm a medical doctor and a fellow of the American College of Physicians. I'm board certified in internal medicine, hospice and palliative medicine, and addiction medicine. and I currently serve as medical director at a federally qualified healthcare center in southwestern Illinois, and I provide inpatient hospice consultations at our local hospital, where I also serve as a part-time hospitalist. So most of the individuals I care for suffer from very serious and often life-threatening disorders. I oppose Senate Bill 3499 legislation to legalize assisted suicide in Illinois for multiple reasons. First, the bill attributes undue accuracy, as Amber said, to the ability of a physician to predict death within 6 months. Personally, I've cared for hospice patients who have met Medicare criteria for hospice on an ongoing basis and yet survived well over a year, one over 4 years. My own father was on hospice, cared for hospice over 2 years with his Alzheimer's dementia. Next, the legislation assumes a quick and peaceful death. However, although massive doses of legal drugs are given to patients with the promise of a serene death, in reality, reports from Oregon indicate the dying process may require several hours. During that time, patients often thrash about and struggle to breathe. In fact, the administration of drugs is experimental, as there is no medical oversight of the compounding, or administration of these lethal cocktails. The FDA has approved no drugs for the purpose of inducing death, and there are no reputable studies of such medications, and no medical societies have published guidelines on the use of the medications for the purpose of ending life. As a physician who treats patients with dementia, I'm alarmed at the public discussion of lethal drugs for these individuals through the use of their advanced directives. It is inevitable that once assisted suicide laws are passed, expansion will occur, as has happened in many states, including Oregon, Hawaii, Washington, California, and Vermont. In Oregon and Colorado, patients with anorexia nervosa have been given lethal drugs. Illinois is not immune from such expansion, and should it decide to legalize medically assisted death. Additionally, the data from Oregon indicate that fear of pain was not in the top 5 reasons cited for requesting assisted suicide, as Amber already said. The most frequent reasons were actually loss of autonomy, being a burden to family and friends, and not being able to participate in life's activities. Those are not adequate justifications for ending one's life. Because over 90% of the patients I treat in my office suffer from mental illness or addiction, I am extremely concerned that Senate Bill 3499 does not mandate that a person requesting assisted suicide be referred for a mental health evaluation. Most people commit suicide due to depression, which is extremely common but very treatable in the terminally ill population, as well as in the general population. There's evidence that depression and existential issues such as hopelessness and loneliness can influence the wish to die and are commonly missed by busy doctors. As a hospice physician, I'm appalled that Senate Bill 3499 ignores that symptoms including pain, depression, and anxiety can be controlled by proper palliative interventions. The bill legitimizes and promotes suicide instead of endorsing suicide prevention. It discriminates against the elderly, the chronically ill, the mentally ill, and the disabled. I believe that the role of the physician is to affirm the lives of patients, to relieve suffering, and to give compassionate, competent care as long as our patients live. Assisted suicide ushers in abuse, discrimination, and injustice. Rather than hastening patients' deaths, we should advocate for increased access to mental health, palliative care, and hospice services. I urge the legislature to reject Senate Bill 3499 and allow medical doctors to continue their roles as protectors and healers. Thank you.
Okay, thank you, Dr. Gardner. I'd like to introduce Corey, who will be sharing a personal story about how she was offered assisted suicide.
I am Corey Sulkert, and I'm here on behalf of myself and patients like me and my children to oppose Senate Bill 3499, legislation to legalize assisted suicide in Illinois. In 2012, I was facing a hopeless medical situation. In spite of surgical and pharmaceutical interventions, my health deteriorated to the point where my doctors and specialists at that time said, "I can't help you. I'm out of treatment options." I was at home, bedridden, on a number of pain and anti-nausea medications, which were also contributing to the overall difficulties. I couldn't eat without horrible intestinal spasming, and for all practical purposes, I was dying. I lost the will to live. If there had been a way to legally die at that juncture with the ingestion of lethal drugs, I would have willingly taken them. But my husband was more objective and determined he would not be paying for a funeral before all possibilities were exhausted. I was taken to a functional medical facility in Mexico where they employed conventional and integrative medicine, and I recovered a good measure of my health, even though it's been determined I'm medically disabled. My autoimmune diseases and other physical ailments haven't been cured, but the inflammation levels are managed so that I can live fairly well in spite of them. I'm disabled, but I am not useless. Our family has fostered 9 children in the past 12 years since my recovery. We have adopted 5 of them who had a terminal, life-limiting condition. 3 of our children have died, having lived very full lives and being supported in every way. They died of a natural progression of their conditions, not because we purposefully asked to end their lives. The 2 young children we are still caring for right now are thriving despite severe disabilities and medical conditions, and both of those, we were told that they wouldn't live past the age of 5 months or 18 months. And my daughter is almost 5 and my son is almost 10, so they have lived well past the initial prognosis. They are fed, held, loved, and given appropriate doses of medication to help them live. Our prayer has been that we can walk away clean, that we didn't in any way hasten their deaths, and didn't unnecessarily put them through medical treatment and procedures which would be more hurtful than helpful. Life is something that should continue through a natural course of events with comforting interventions that leaves everyone with a sense of well-being by allowing the dying person to live until such a time as they meet hospice criteria. And we continue to give our children proper nutrition and hydration until such time that was no longer helpful. Appropriate end-of-life medications are given to aid with any pain or air hunger. Our children were not killed. They've been lovingly supported until they die from a natural shutting down of all their body systems. Once we decide that someone can choose to end their lives with lethal drugs, it will be easy to conclude that people like me and the children that we care for should be eased out of their lives for their comfort, to save money, or because their existence is meaningless. This is happening in other states and countries to adults and even to children like the ones I care for, while new reasons are championed to include more people being eligible for lethal drugs. Don't think that can't happen in Illinois. It is tragic to give up on anyone, especially when they may have more time and quality of life than we can predict. I know I will fight until my last breath for the children entrusted to us. Fight to give them the love and care they deserve, and fight to make sure that no one ends their lives prematurely. I pray that Illinois will resist the push to go down the road to legalize lethal drugs.
All right. Thank you, Corey. I'd also like to introduce Heather, who is here to talk about her personal experience as well.
Thank you. My name is Heather Weininger. I'm a wife, a mom to 4 young children, and I'm also the executive director of a state organization just north of here in Wisconsin. But I'm also a survivor of anorexia. I am opposed to Senate Bill 3499, this legislation to legalize assisted suicide in Illinois. As I stand here before you today, I'm a thriving woman who doesn't show any signs of disease. This wasn't always the case for me. And many years ago, I would have taken the same path as others who face this battle with anorexia by using physician-assisted suicide. As a teenager, I was a high achiever. I did well academically. I had a wonderful social life, wonderful family that supported me, and really nothing much to worry about. Several things sent me into a tailspin while I was in college, and it included my long-term boyfriend at the time breaking up with me, and also at the same time my grades began to decline. And restricting my eating really was the only thing that I had ultimate control of. I didn't know or really understand at that time that I was suffering from a mental illness, and it was coupled with depression and OCD. The night decided that I did not really want to be here on this earth any longer. I reached out to my sister, who happened to be living in another state at the time, and thankfully she immediately reached out to my parents that night, who quickly acted on my behalf. I was over 18 at the time, so they were not able to make any kind of medical decisions for me, but my parents became my advocates. And during my treatment in an outpatient setting, I told my mom how much I hated her for doing this to me. I was angry at my parents for wanting me to get better, but they did everything in their power to help me find that help that I needed. And if my sister had not called my parents that night, and my parents hadn't driven down and picked me up from college and bring me home, I wouldn't be standing here with all of you. Now that two young women in Colorado in their 30s have been given these lethal drugs to end their lives, I'm growing more and more concerned for those who suffer like I did. According to an article in the Journal of Eating Disorders, there's a growing recognition that palliative care may be appropriate for some patients. But the clinical characteristics for terminal anorexia, they have not been proposed. And it also notes that the high percentage of those suffering who die by suicide, and that there's that high percent that die by suicide, and that health professionals in this profession of eating disorders, they offer really little support for end-of-life care. The article goes on to then offer proposed clinical characteristics of patients with terminal anorexia. What's so concerning to me is that the care offered to these patients is so broad, often not having anything noted about treatment for mental illness. And the mental illness part of the disease was what kept me from making rational decisions about my life. It's so important to understand that while anorexia is a restriction of food, it's a restriction of nutrients to our brain. And along with that, there are many times these accompanying mental illnesses that can be treated easily with psychiatric medications. And now there are patients who are declining these psychiatric medications for this manageable disease. Thankfully, I was able to overcome my depression and my OCD with these medications. And they were ones that I did not have to take for a great length of time, nor do I take them today. But they were enough for me to set myself up for long-term success. I'm horrified that patients with anorexia are being given these lethal drugs instead of treatment for what I clearly see and experienced as a mental illness. Just like Colorado, they expanded the reach of its assisted suicide law to include anorexia patients. Illinois could see the same progression if Senate Bill 3499 is passed. I urge this legislature to protect lives like mine by rejecting this bill. Thank you.
Thank you. I have a feeling you probably taught a lot of people an awful lot that they didn't know just now, both of you. I would like to introduce one other speaker, and that would be Julia, who's here with a story about her father.
My name is Julia Morell, and I'm speaking here in opposition of SB 3499, an Illinois bill to legalize assisted suicide. 2 years into his battle with cancer, my dad, Paul Morell, received a stage 4 diagnosis. Despite the doctors telling us that the average person with this diagnosis wouldn't live past 24 months, he never wanted to stop fighting. Because of exceptional effort and extraordinary medical treatment, my dad lived for 6 more years, far beyond any prognosis ever given to him by any of his skilled and caring doctors at Dana-Farber in Boston. And in that time, I even got an unexpected little brother. He's right here. And the doctor said that even that was something that was not possible. Doctors' prognoses are often inaccurate, and patients can and do live much longer and fuller lives than ever expected. Had assisted suicide been legal in Massachusetts, my dad could have been denied coverage for the very treatment that elongated and enriched his life. My dad would have been eligible for suicide on the basis of a prognosis that was inaccurate by a factor of years. In Oregon, where assisted suicide has been legal long enough for its inhumanity to metastasize, the list of conditions which are eligible for a lethal prescription has grown to include diabetes, heart disease, and arthritis. We have the ability to treat these people, but the pressure for cost containment in a profit-driven healthcare system creates a future where it is possible that you could be denied proper treatment to prevent your death. A 64-year-old cancer patient in Oregon was denied coverage for $4,000 a month treatment that would have saved her life. Instead, her insurance company offered to pay for her assisted suicide for the cheap cost of $50. Through the selective legalization of suicide for a certain class of people, the state makes its judgment clear that the sick, in their time of greatest need, do not have lives worth living or worth paying for. But every unpredictable day of my dad's life mattered. I had 10 short years with him, and every bit with him was impactful. I learned by watching his strength in accepting weakness. And as a daughter, I was able to serve my dad just as he had served me. From the depths of my heart, I empathize with the multi-layered suffering of end-stage terminal illness. I witnessed my father's gradual decline to his bed, his gradual confinement to his bed. And I endured heart-wrenching days, truly heart-wrenching days, where his declining state provoked fleeting questions of how can anyone go on like this? But amidst those difficult times, there were many, many good days. There were days when I would adjust his oxygen and then run out to the backyard and practice my cartwheels, and knowing that he was cheering me on through the window. I knew that he would have given anything to run around outside with me, but simply having him there was enough. In terms of physical pain, my dad was immeasurably relieved by palliative care and hospice, and I'm deeply grateful for these services that shepherd the dying through the process in a truly compassionate and pain-free way. Can you guess what percentage of patients in Oregon were referred for the Safeguard psychiatric evaluation before receiving a lethal prescription? 1%. 1%. This is not compassionate care, and this is not death with dignity. In those final weeks of my dad's unpredicted longer life, my dad became more and more vulnerable. In that time, even while on oxygen, weak and coughing throughout, my dad painstakingly made individual videos for me and my brothers, expressing his hopes and his dreams and his love for us. And I wouldn't take any of that back, and I wouldn't do it over or have it be any other way. I'm grateful that he had the choice. In the last hours of his life, I laid next to him, and I took his face into my hands, and I whispered, "We'll be okay, Dad. You can go home now." And then he took his final breaths. Proponents of this bill want to portray natural death as necessarily painful, undignified, costly, and humiliating. They want to tell you that this bill will increase patient choice. But the reality is that the inevitable consequence of the legalization of assisted suicide is the release of a money-hungry wolf in the sheepskin of patient choice. And this is a truly dangerous, slippery slope of declined treatment for those who want to fight to live. Thank you.
Okay. The chewing for you. Okay. So this is Amber again, and what I'd like to do is just state a couple more things in relation to this topic. You've heard some very personal stories. The nature of this particular issue is very difficult because there is nobody in this room who has not been touched by death. and nobody in this room who has not been touched by pain. And so if this bill it gets heard before the legislature, there will be people on both sides who have experienced significant pain, trauma, stress, and it has changed their lives. So there's nobody who this doesn't touch. However, I think when it comes down to it at the end of the day, this bill is about adding something to a system that doesn't work. And as you can see, there are going to be safeguards that are just going to fall by the wayside. What Julia said about the 1% of people in Oregon getting a mental health evaluation, that's a big red flag. But that is what proponents will say. That's a safeguard. You're able to get an evaluation. The question is, do you really get one? Another potential safeguard is, only people who are competent to make their own medical decisions can do this. Well, there are a lot of disabled people who medical professionals will deem competent to make their own decisions. There is no way that this is an automatic screen for people with disabilities. Okay. So there are pieces of the bill that won't work. However, I think what we're all here to say is that in the end, it's not about what's in the bill. It's the fact that bringing assisted suicide to Illinois will open a bigger can of worms than anybody ever thought would show up in the state. And it's already tearing people apart. So we're asking for opposition to this bill. We're asking for reasonable discussion. We're asking to be heard with all the arguments. And, this particular argument that you're hearing today, the disability and the medical one, it sometimes gets a little bit lost in the overall dialogue, and that's why we're having this press conference today. So with that, I am going to wrap up. Questions, if anyone has them, can be taken out in the hallway. Thank you very much. Thank you for traveling all the way down here. Let me get away from the mic.